I'm Dr. Javier Davila at ESANA MedSpa, and what we're going to do here today is demonstrate the use of filler injections to correct some of the folds and creases that occur with an aging face. There are a number of materials that you could use to this purpose. Some of the brands are included here: Belotero, Restylane, Juvederm, and Radius, all of which have different properties for different depths of injection and what the purpose of the correction is going to be. Today here we have Mary, who is age 50, and her main concerns are a deepening nasolabial fold, a slight sagging of the commissures, giving a frowny appearance here at the corner of the lips, as well as some loss of volume out here on the cheekbones. So it makes it seem that things are falling down in this direction, leaving nothing up here. So what we're going to do for her today is fill out the nasolabial folds, boost up the commissures, and replenish the lateral portion of her cheeks on both sides. The first thing we will do is take alcohol to clear out her skin and make sure that we minimize the risk of infection from the fillers. She has no makeup on, so she's made that easier for us. And the first thing we're going to do is we're going to start by adding some more volume to her cheeks by replenishing the outer portion of the cheeks where it should be the most projection, but now that has changed with age. Most fillers have an anesthetic mixed in with them, which makes the injection much more comfortable than what it used to be. And you can directly, 1, 2, and 3, change the contours the minute that you inject, giving you the instant gratification of returning to a more pleasing shape that she used to have in her younger days, correct? All right, good. So this adds a little bit more out here to change that balance, and we're going to do just slightly more out here on the side. And as you can see, this requires minimal smoothing. And for her, viewing from above, you can see where the correction is here and where she needs more product on this side. Sorry, 1, 2, 3. One of the risks of this procedure is bruising at the time of the injection. Anything that involves a needle can cause a bruise. In her case, we don't see anything happening just yet. Okay, that's the last little bit from that. All right, very good. Then we'll focus on these areas. So we're going to do some injections here under the commissure to support that, 1, 2, and 3. And this will help bring up the corners so that we eliminate the sagging appearance, and massage to make sure that things are okay and there is no signs of bruising. Next thing, we're going to do the nasolabial fold and a couple of different passes to place the product exactly as we need it to be. So now we'll go to this side where you can see we still have not corrected the nasolabial fold and also the sagging corner of the mouth. So here we go, 1, 2, and 3. And these are small amounts. It's a very comfortable injection because of the anesthetic in the material, and most of the fillers come with that. And next we'll take care of the fold here. 1, 2, and 3. And for different patients, it's a different depth of injection or the amounts that you're using. That all has to do with the architecture of your face. But for most people, aging involves the creation of these lines coming down. Very good. Give me a smile. Great. And relax. Is anything uncomfortable?
Not at all.
Good. So what we've done here for Mary is we've taken care of the depth of the nasolabial fold. We've increased the projection of the outer portion of her cheek and also raised the corner of the mouth. And you know, with these fillers, what's crucial is how it's done. The person that's doing it, the skill of the person that's doing it, and understanding what her goals are. In other words, a different patient may have had a concern up here rather than down here. So it has to do with what her goals are and who's injecting it. So here at ESANA, it's only the physicians that do the injections for all fillers. So what do you think of this? Does this meet your goals?
It looks great.
Good, good. I think it looks fantastic. And now what we're going to have you do is hold an ice pack simply to cool down the areas and minimize your risk of bruising. So we're going to have you just hang on to that. and that will keep it much more comfortable and cool down. Anything hurt?
Not one bit.
All right, very good. I'm Dr. Javier Davila, a board-certified plastic surgeon at ESANA Restylane, and you've just seen a demonstration on the use of filler injections to reverse signs of aging on the face. For more information, visit our website, www.esanametspa.com.